While mental health means something different to everyone, we want to dive a little deeper and hear from someone who works with it on a daily basis. Joining us now from Neurosciences Group is Dr. Khalid Sethi. Dr. Sethi, thank you so much for joining us tonight.
Oh, thank you so much for having us.
Now, in your personal and professional opinion, what is mental health?
So we can think of mental health as a disease, not something that is how you are, but a disease that impacts you, the individual, on how you process information or stimuli around you. So, walking in and seeing some kids playing in the park and splashing it, while may make some of us feel happy and bring some warm feelings about ourselves on how we're processing that information, it may not have that same impact for other individuals. So it really, in my mind, is a very structural, basic processing issue that forces people to feel differently to the same stimuli that other people might feel.
Now, you work with people every day, people who are battling some form of mental illness. For many people, the hardest part is simply recognizing when it's time to seek professional help. How can someone determine when it's just an off day and when it's time to actually talk to someone?
So I think if you find that you are not enjoying life on how you are living it, you're finding altered sleep patterns, you're finding altered appetite patterns, you are not interested in food, or you're overeating or undereating. You wake up feeling kind of down or depressed. You are no longer enjoying activities that you used to enjoy in. You feel out of sync with your environment, where you feel you're more jittery, you're more nervous than other people around you. You're more uncomfortable, you're more out of your zone. You're not in the element that you used to be in. I think those are all signs and symptoms. And it's not just a one-day thing. It's something that is impacting you. And it's impacting the quality of life. It's impacting who you want to be. And there's a disconnect on how you're living your life and how you would want to be living your life. I think that's what should get you to see, is there something going on with me where something can be done to help you?
And I know you specialize in depression treatment. Talk us through some of the different treatments and resources out there.
So again, it's how to help process things better. So some of it is changing the perspective of how you view things, how you interpret things. And that's where a lot of counseling comes in. So you can have individual counseling, you can have cognitive behavioral therapy, you can have group sessions and so forth. We know that a lot of the processing dysfunction can be referable to a chemical imbalance. So part two is medical management. And there's a whole host of category of drugs that help allow you to process things much smoother. And medications can work. But what's really exciting and what's coming on now to the field is looking at neuromodulation, which is how do you create meaningful changes in how your brain processes things. And that can be done using techniques that are non-invasive, that are not pharmacologically dependent, and that really have more substantive, meaningful changes for the person.
All right, a lot of great resources there. And sometimes people struggle with even admitting they need a loved one, a doctor, or even themselves. And I'm sure you can attest to this. Mental illness, it affects everyone, and even the strongest of people fight invisible battles. What do you think still needs to happen when it comes to ending the stigma surrounding mental health?
So I think what happens is people need to recognize what we term a disease. So a disease is defined as an affliction that comes on to you for nothing that you have done. So if you're diabetic, everybody recognizes I'm a diabetic, my pancreas isn't working as well, I need medications, I need injections, I need enzymes. I have back pain, nothing that I did, but I seem to have a lot of back pain, pain down your leg. I've got heart disease, I've got to take care of myself. There are behavioral modifications that you can do, but everybody accepts that as a disease. Depression needs to be recognized as a disease. It's a true disease that's not somebody's making it up, that doesn't make you any less of an individual or less of a human than anybody else. It is a disease that you have to battle with and struggle with, but you should not have to battle and struggle with it on your own. There's a lot of help, but it doesn't start until you come see your physician. Nobody's going to know you have heart disease unless you come to your doctor and say, I'm having chest pain and shortness of breath.
Right, absolutely. And we'll end out with this, Dr. Sethi. Do you have any tips when it comes to positive mindsets and just giving your mental health a boost?
So again, if you think about it, we talked about it's a processing information. So what helps processing is exposure. So you know what used to help you. You know what fond memories you have of the past. You know when you were your best self. Everybody has deep down in our treasure chest moments of happiness. We should revisit them. Going outside, partaking in activity, getting interested in activities, volunteering yourself, surrounding yourself with friends who, care about you, getting interested in causes that are not about the individual, but a greater self. All of these things will get us engaged and will, in a sense, allow processing information to occur with familiar tasks and environments and stimuli that have reproducible benefit because these are the activities that have made you happy in the past.
All right, Dr. Sethi, thank you so much for sharing your insight tonight and really just talking about this incredibly important topic.
Thank you so much for having us. These are trying times, and I think it's very important for people to know that they're not alone, that there's a lot of help out there, and we're here to help them get their lives back.